Am I audible and visible? Hello everyone. Let me know. Audible and visible. Let me know. Am I audible? Am I audible? Hello everyone. Welcome to Unacademy Doctors. I myself Dr. Dipti Kariya. I'm MD PhD Physiology. I'm Associate Professor and I'm educating MBBS nursing in physicians. I have more than 17 years of teaching. Let me explain in brief about our subscription. We have two varieties of subscription. One that is plus subscription. Here you can choose the best from the best. Here you can access both live as well as recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access question bank, which is having more than 25,000 questions, and you can compete in live test as well as this. And within 12 months, we are coming with a printed note. Second is our iconic subscription. Here, your access to the best from two of the best. And the two are one that is Unacademy and Prep Ladder with Unacademy, in which the features I have already discussed. We have well-structured live batches. We have recorded classes which covers your full syllabus. We have a question bank which is having more than 25,000. You can compete in the live test and this, as well as will provide you comprehensive printed and digital. Whereas in second one, that is Unacademy and Prep Ladder with Prep Ladder. Here you can have clinical and integrated essentials, video lectures from the Dream Team, Question Bank 3 with active guidance, rapid revision and snapshots and pressures in 2021. So you can subscribe from your mobile, either plus or iconic subscription. And you can use my code DIPTI10 to get 10% extra discount on each subscription. Longer the duration of subscription, cheaper are the rates. There are certain features which we have added in our special classes. Here, special classes, they are made interactive and live class. You can attend live class as well as you can participate in the live chat and get your doubts clear during the class only. You can have a facility of raise a hand. You can talk to your educator in the live class. Gets your doubt clear. Also, poll for the learner. That is also a special feature. Then, sorry, just a minute. Any message I can. Then you can never miss a class because always you are getting notified for your class. You can get lecture notes. You can download the lecture notes as well as you can get access to the recorded sessions of live classes. And you can access your classes anytime and anywhere. You can attend live classes as well as participate in the live chat and clear your doubts. Again, as I told you, we have updated and highly effective question bank, which is having more than 25,000 high yield clinical questions, which are based on latest exam pattern. Is also important. And along with that, we are including detailed explanation of all this question. This is our NEET P September 2021 toppers. Here this shows our schedules of exams, various exams we are taking during the month, different months. This is for December 2021. Again, also we have started our FMGE 2022 comprehensive batch, which started from 15th December 2021 and duration is 6 months. And second, that is Target Need P 2022 test sorry, and discussion batch. It was also started from 15th December and its duration is 3 months. Okay, now next is, this is our subscription. As I told you, these are our subscription rates for Plus subscription as well as Iconic subscription. Okay, now let us come to our today's topic. Before that, I would like to tell you that all our classes, they are on Unacademy Future Doctors channel. We are posting, they all are free to access. You can access all these classes free. If you don't have subscription, not to worry, you can attend all these classes. Okay? Now let us start with our test. Today's topic, that is pulmonary function test. This is theoretically important as well as clinically also. This topic is very important in your clinics when you come across patient having disturbed lung functions. You are supposed to perform all these tests. So clinically also this is very important. Now, starting with aim of the test. Why do we perform this pulmonary function test? This is to provide quantitative, first I will tell you, then I will explain, quantitative and objective assessment of physiological derangement associated with pulmonary disease. I'll explain you. With pulmonary disease, what is this? Suppose somebody is having lung disease, so we can quantify the damage. Means the disease is mild, moderate or severe, we can quantify. One thing. Second thing, we can objective, means we can of multiple choice or objective questions. We are telling that suppose the person is having lung disease, whether it is obstructive or restrictive, this objective assessment. And assessment of what? Physiological derangement. Which derangement occur in this individual from normal physiology when the person is diseased. So this is aim of the test. Okay, so this is about aim. Now this test are used. What are the uses of this test? Number one, that is they are used for identification. Sorry. Sorry. These are used for identification of cause of respiratory symptoms. Suppose somebody is having difficulty in breathing. Okay, so we want to identify cause of the disease, whether it is obstructive or restrictive, so we can find out with the help. Second thing, we can find out severity. Suppose a person is having obstruction, whether it is mild or moderate or severe, that also we can find. Okay, then we can diagnose functional abnormality. Functional abnormality means whether it is obstructive disease or restrictive disease, or there is abnormality in the ventilation, that also we can be able to identify by this. Let us revise one, that is identification of cause of the symptoms, cause, severity. Third, functional abnormality. Fourth use, that is identification and screening of unsuspected disease. Now, what is the meaning of screening? For example, suppose when you were in school, what they are supposed to do? So sometimes you have a screening for refractive error, specs. So the school children, all the children, they are tested for refractive error. So that is known as screening test, because it is the group which is more susceptible to that disease. So same way, if suppose some group that is working for some specific occupation in which lung diseases are common, so we can screen those patients. Okay, so this is another use. Then you can assess airway sensitivity. If somebody is having allergy, so if we want to find out which allergen is there, so what we do is we just perform the test, then we give that particular substance, inject the substance, and again perform the test. So we can easily assess that to which the person is sensitive. Okay? Then another important thing is assessment of reversibility of obstruction. Suppose somebody is having airway obstruction, the person is taking treatment, and after taking treatment, if we are performing the test before and after, so we can know that whether this disorder is reversible or not. Okay? Then next is evaluation of treatment. The same thing, the person is taking treatment, and if we want to know that whether the person is treated well or not, so that can be evaluated. Then long term follow up. Suppose somebody is coming after long time, then at that time also, if we have previous record, we can compare it with this record of today. Okay, now these tests are classified in 3 groups depending on the functions, as the tests are pulmonary function test. So the functions, which are the functions, as we have discussed, one function of the, we have discussed in the first lecture, respiratory system, functions of respiratory system. Okay, so which are the function? First function is pulmonary ventilation. Pulmonary ventilation. Ventilation is nothing but entry and exit of the air. Okay? Air enters, air exits from lung. So to assess the ventilatory. Second, that is to assess gas exchange here. Exchange of gases. Okay? Here you can see one is, first is external respiration. Here this is gas exchange. And third, this oxygenated blood is transported to the circulation. So transport function, that is third function. Okay. Now next is first one, test to assess ventilatory function. In the ventilatory function, what do we assess? We assess expansion of lungs and chest wall. Okay. So for that, as I told you, whenever there is ventilation, there is expansion of lungs and chest wall. And during that, there is change in the pressure and volume. When lung wall expands, pressure inside the thoracic cage, inside the pleura and inside the alveoli, they change. So what do we measure? We measure first is pressure. Which pressures we are supposed to measure? One is intrapulmonary pressure. Another name is intra-alveolar pressure. Pressure inside the alveoli here. This here, this is transpulmonary. Intra-alveolar. And second one, that is intra-pleural pressure between parietal and visceral. Okay. Now, so which are the normal values of this pressure? One is intrapulmonary pressure, or it is known as intra-alveolar pressure. Okay. You can see here, beginning of respiration here, this is 0. Okay. Then this becomes, Dr. Kariya. Okay. Then this becomes intrapulmonary pressure, which is also known as intra-alveolar pressure. So this is intra-alveolar, inside the alveolus. Beginning of respiration, this pressure is 0. Okay. Now, during inspiration, this pressure becomes highest at -1 centimeter of water. Okay. And at the end of inspiration, now again it becomes 0. Okay. Here. And this pressure change, -1 centimeter of water, it brings tidal volume inside the lung, that is 500 ml. Now 500 ml air enters because of this pressure change. Okay. Opposite is true here during expiration. Beginning of expiration, pressure is 0. During expiration, the pressure increases highest +1 centimeter. This is mind, this is centimeter of water. Try to remember this value, centimeter of water, which is given in standard textbook Guyton. Okay, this is the value from Guyton. Some of the books, they have used the value millimeter of mercury, but try to follow the standard values. Okay, so here it is +1 centimeter of water. Okay, now here what happens? This brings Again 500 ml or tidal volume, that is out. Okay? So this is your intrapulmonary or intra-alveolar pressure during inspiration and during expiration. Okay? Next is intrapleural pressure. Okay, let me erase all. Okay, so here you can see this is intrapleural pressure. This is intrapleural. Okay. Now the values also here also try to remember values from standard textbook. This is the diagram from Guyton only. Intrapleural pressure. Beginning of inspiration here. Okay. It is, or you can say at the end of expiration. So this is minus 5 centimeter of water. Okay. During inspiration, this becomes more negative. You can see here. It is always negative. Intrapleural is always negative. Okay? Because it is a suction pressure which is required to hold FRC volume, functional residual capacity volume inside the lungs. We require negative pressure. This is our intrapleural. Okay? So this is in the beginning of inspiration. This is minus 5. During inspiration, it becomes negative here, which is minus 7.5 centimeter. And during expiration, at the end of expiration, again it comes back to minus 5 centimeters. So these are the normal values you must know. Okay? Normal values for intrapulmonary and intrapleural. Okay? Next one is compliance. We will discuss in our next chapter, next live chat, discuss in detail what is compliance. Compliance is distensibility of lungs. Lungs are distensible tissue and the distensibility is measured in the form of compliance. The formula is delta V upon delta P. We will discuss in detail. Okay. Now, compliance of lungs only is always higher. This is 0.20 liter per centimeter of water, or it is known as 200 ml per centimeter of water. What does it mean? When pressure increases 1 centimeter of water, lungs can accommodate 200 ml of air. This is the meaning of the complex. Okay, and when this lung and chest wall combined compliance we want to measure it, the value is this. These are standard values. Please try to follow. This is 0.11 liters per centimeter of water, or 110 ml per centimeter of water. Okay. What does it mean? With 1 centimeter of water, increase in the pressure, volume accommodated in lungs and chest wall, that is 110. Okay, we will discuss in detail. Now, second function test, that is, what is the second function test? This is assessment of restrictive and obstructive ventilatory defects. That is, we are measuring, as we have discussed in our previous class, that is lung volumes and capacities. Okay, we are measuring, I think all of you are knowing, vital capacity, tidal volume. Okay, this is vital capacity, tidal volume, IRV, ERV. So these all resolve residual volume, total lung capacity. So these all are measured. Plus resistance is also measured because airway resistance is increased in the obstructive disease. And this provides very good idea about fitness of the individual as well as type and extent of derangement. As we have discussed, you can watch that video of lung volumes and capacities, that there is a defect in the, if there is a restrictive lung disease, what is the change in timed vital capacity and what is the change in timed vital capacity when there is obstruction. Okay? So we can also find out the lung functions, type of derangement. So this is about first function. We have discussed three functions of the lungs. That is, first, that is test to assess pulmonary ventilation. In ventilation, we are assessing pulmonary pressures and volumes. Okay? And second, that is test to assess gaseous exchange. Okay? So for that, we have three tests. Number one, that is measurement of functional residual capacity. This one. It is not measured directly because it includes residual volume. This volume of air cannot come out. Okay, so we cannot measure this. Then Second test is to measure dead space volume and air and measurement of diffusion capacity of lung. We will discuss in detail. For FRC measurement, we have discussed. We have two methods. One that is open circuit method and second that is closed circuit method. Open circuit method I have already discussed in my topic of lung volumes and capacities. You can go through that video also. I'm just briefing the same thing here. So here you can see open circuit method, which is known as nitrogen washout method. Second, that is closed circuit method or helium dilution method. Now, what is this open circuit method? You can see here, I'm just briefing the same. Here you can see, ask the person to inspire pure oxygen, okay, for 5 to 7 minutes. Why 5 to 7 minutes? Because in this 5 to 7 minutes, the whole FRC is replaced. Okay, so inspire pure oxygen. So he is inspiring here from this pure oxygen and expiring in the spirometer, which is nitrogen free. Why nitrogen free? Because we are measuring the nitrogen which is coming from FRC, and from that nitrogen value we can measure FRC. Okay, this is the main principle. Okay, so now for 5 to 7 minutes, first of all, procedure: ask the person to inspire from oxygen cylinder and expire in the spirometer, which is nitrogen free. So now what happens? Suppose the person has inspired for 5 to 7 minutes. Our respiratory minute volume, so in 1 minute or minute volume, how much amount of air is coming out? That is 6 liters. As I told you, respiratory minute volume is equal to tidal volume into respiratory rate. Tidal volume is 500 ml, respiratory rate, that is how much? About, suppose if we are taking 12 per minute, so this will be 6000 ml or 6 liter per minute. So in 1 minute we are expiring 6 liters. In 5 to 7 minutes, suppose we are inspiring 40 liters of air. Now from this 40 liters you take a sample of 100 ml and measure how much nitrogen is there in this 100. Suppose you have taken a sample, okay, 100 ml of air, and measure that how much nitrogen. Suppose it contains 5 ml. So 100 ml contains 5 ml nitrogen, means 40 liters of air contains how much nitrogen? So this you can calculate. It would be 2000 ml. That is 40,000 multiplied by 5 divided by 100. Then the value would be. Now this 2000 is not 100%. It is 80% only. Why? Because nitrogen which was present in the FRC is 80% of total volume. As we all know, that person has inspired from atmosphere, and atmosphere contains 78 to 80% nitrogen. So you can say 80 ml nitrogen in 100 ml air, 1000 ml nitrogen in how much air? So we can get the value, that is 100 multiplied by 2000 divided by 80, 2005 ml. This is FRC. Next is closed circuit method, that is also known as helium dilution. Here what we have to do is closed circuit, means we are inspiring as well as expiring both in the spirometer. Okay. Same spirometer here. First of all, spirometer is filled with a gas mixture, and the gas mixture is having known concentration of helium. Suppose we are knowing that 10 liters or 20 liter helium is there in our gas mixture. Okay. And ask the person inspire and expire in the same spirometer. Okay. So now what happens here, when the person is inspiring and expiring for about 8 to 10 minutes. Okay. Now, so what happens here, we can calculate from this calculation. The calculation is V1 C1 is equal to V2 C2. Now what is this? Means initial volume and initial concentration is equal to final volume and final concentration, because the person is inspiring and expiring in a closed chamber, not moving out, not entering air, no air enters inside. Okay. Now, so you can see here V1 C1, V1 that is initial volume, V2 is initial concentration of helium. We are more concentrating on helium because helium is not normally present in our atmosphere. So whatever helium enters and coming out, that is from FRC, or whatever helium is replaced, that is replaced by FRC. Okay, so again you can see now V2 final volume of spirometer. Final volume of spirometer means V1 is initial volume plus FRC. Okay, so finally why? Because FRC also is added. So you can see here by this formula V1C1 is equal to V1C2 plus FRC2. Okay, now this FRC here, so FRC is equal to V1C1 minus V1C2 here. FRC is V1C1 minus V1C2 upon C2. So by this formula we can calculate FRC. Okay, now so this is about FRC. Second thing which we are measuring, that is measurement of anatomical dead space. What is this? For that we have used Fowler's method. In that what we are supposed to do, ask the person to inhale pure oxygen. First, when the person inhales pure oxygen, all the dead space is filled with the pure oxygen. Then ask the person to expire in the nitrogen meter, which measures nitrogen content. So initial air which is coming out this much, which is not containing nitrogen, only containing oxygen, this is the air which is dead space. And once nitrogen starts coming, that is alveolar air which is coming out. Okay, so now how to measure here? Dead space is equal to gray area multiplied by tidal volume upon total area. Okay, so by this method we can measure anatomical dead space. Next is physiological dead space. Physiological dead space, that is anatomical dead space plus alveolar dead space, that is measured by Bose equation. We have also discussed this. Here also PV is equal to constant. Is PV of inspired air is equal to PV of expired air. Okay. So, and here we use carbon dioxide. So partial pressure of carbon dioxide in the inspired air into volume of inspired air. Okay, volume of inspired air is tidal volume, is equal to partial pressure of carbon dioxide in expired air and volume of expired air. This is also tidal volume. Now here, this volume of inspired air is further divided into tidal volume. It is tidal volume, but it is divided into alveolar air, or you can say alveolar air, and second, that is your dead space air, T. Okay, so you can see here pressure in the inspired air multiplied by volume in the alveolar air plus volume in the dead space is equal to partial pressure of carbon dioxide in expired air and volume of expired air. So this is the formula. Here what we can do is this one, partial pressure of oxygen in alveolar air and dead space. Okay. So partial pressure of oxygen here again in inspired air VA plus partial pressure of oxygen in inspired air and dead space is equal to partial pressure of carbon dioxide in expired air and volume of expired air. So from this formula we can calculate dead space. Okay. If we are knowing this all, then we can easily calculate physiological dead space. Okay. Next is diffusion capacity. Very important thing here. Diffusion of gases. So how can we calculate diffusion capacity? That is by consumption of any gas. Suppose we are talking about diffusion of oxygen. So oxygen is consumed divided by partial pressure difference. Means suppose somebody has taken 5 liter oxygen divided by what is the difference between these two. Okay, and that is the volume which is diffused. So that is diffusion capacity. Okay, but it is difficult to measure diffusion capacity for PO2. So for that, what we do is we use diffusion capacity of carbon monoxide, and then from which we are calculating diffusion capacity of oxygen. Why, I will discuss. So you can see diffusion capacity of carbon monoxide is equal to carbon monoxide uptake divided by, means suppose how much carbon monoxide the person has taken, divided by alveolar carbon monoxide minus pulmonary capillary carbon monoxide. Now here you can see here, because all the carbon monoxide binds with hemoglobin, so plasma concentration of pulmonary capillary carbon monoxide is 0. So we need not to measure this value. This is the value which is difficult to measure. And here for carbon monoxide, it becomes 0. So you can measure from this two value carbon monoxide uptake divided by alveolar carbon monoxide. Okay? And whatever diffusion capacity you get, you can multiply it with 1.23 and you can get the value for oxygen. Okay? So this is about second function test. Third function test is test to assess transport of gases. Now our blood gets oxygenated. How it is transported? For that, we have to measure partial pressure of oxygen and carbon dioxide in the inspired air, in the expired air. Then only we can know, and alveolar air. As well as we can take sample from the artery and blood gas is analyzed. That is, when you go to clinics, you come to know that arterial blood gas analysis of the arterial blood gases, and acid base disturbance also is measured. So this is about the third test to assess transport of gases. So long question from today's topic asked, that is pulmonary function test. Okay, thank you. If you like my video, you can like, you can share, and you can subscribe our channel Unacademy Future Doctor. Thank you.